Hello, everybody. Dr. Arco here, and we're talking about how do you build trust in teams. This is a continuation of what we were talking about last week. My name is Dr. Elsie Coe. I am the CMO of American Endovascular and Amputation Prevention and the CEO and founder of Lead Physician Leadership Program for physicians, giving them the passion, bringing back their purpose, and having them reach their potential. Go to our YouTube channel, Lead Physician, to listen to all of the free videos from awesome guest speakers who teach us about leadership. Today, we are speaking with Robert Underwood today. We've brought him on before. He is part of the Lead Physician team. He has a role. This is what he looks like. And he's also written a book. If you haven't gotten that, this is a fantastic book on leadership. I highly recommend it. It is about how you lead with values and develop your leadership philosophy through a story with a lot of tips and tricks on how to do that. So, without further ado, let me just bring him on board here. Uh, hey, Bob, good to see you again.
Good to see you, Elsie.
It's been a while.
Yeah.
Um, let me just also introduce you a little bit. He's also the chief medical officer of San Juan Regional Medical Center in Farmington, New Mexico. He has a long history of being taught leadership from the military, been through West Point, in the Army, U.S. Army, and I'm so happy for you to be here. He's has expertise in organizational development and leadership. Tell us, Bob, why is this so important to you, this topic?
Yeah. Honestly, Elsie, when it comes down to it, the leadership is founded on trust. If you don't develop a level of trust with your team, then you really are not going to be very effective as a leader. And so that really is kind of the cornerstone to everything, or the foundation. That trust is the foundation of leadership. And there's lots of ways, and we've talked about it. And the book that you already mentioned really talks about developing your leadership philosophy, but also in the presentations I've done, is it really starts with your values. And you build upon your values. Your values in action become virtues, and the demonstrated virtues show your character, and your character is what builds into trust, a demonstrated character of integrity. And that becomes trust. And without that, you can't lead. So trust is the foundation of all of it.
Yeah, I love that. Thank you so much. So tell us a little bit about how do we build trust. We spoke about this last week with Janet Schley, and just building upon it. We were talking a lot about engaging our teams and high
Mm-hmm.
performing teams, and even just to get there, we need to start from ourselves, is what you've been teaching about all along, about this leadership philosophy, understanding what your values are. Can we
Right.
walk through those steps, Bob? I think those are so important.
Yeah, absolutely. And, as we've talked about in the leadership philosophy, you actually outwardly state, these are my values. These are the things that are non starters for me. These are the activities that I'm going to take part in order to demonstrate these values to you, my team. And as you know, when I talk about the leadership philosophy, once you have that written and you've stated exactly what it is that you're going to do, you share that with your team. And that starts to form that basis of integrity. Is, are you carrying out and doing the things that you promised us that you were going to do? Now, I share my leadership philosophy. You have a copy of it. But I
That's
share
right.
my leadership philosophy with my team. Some of them have it posted on the cork board that may be behind their desk. I also share it with my superiors and my peers at the senior leadership level of the hospital. So you're stating up front what are the promises or the obligations that you're having to the organization, and then you're fulfilling that. There's lots of components that build up trust. Now, part of that is transparency. And if you establish that right away with your team, then you're already making headway towards developing trust. Now, trust is earned. It is not something that you're just going to walk into a new position and everybody's going to say, "Oh, look, there's the new guy. Let's let him direct us in a way that we don't know where we're going or what he's going to." That just doesn't work that way. The other part is it really is multifactorial. There are so many variables of trust that you have to be able, as a good agile leader, be able to adapt to those circumstances. For example, the organization will have a culture which grows or diminishes trust, and you have to work within that organization. Other things are is you have your team, and your team, based on their prior experiences before you were ever their leader, they may have issues about how much they may trust a new leader or not. And then there's, of course, the situation. We have found ourselves in a very unique situation over the course of the last 2 years when it's a different level of trust when we're implementing new policies and new protocols around PPE. This is a trust level that is really about, are you going to keep me safe
Yep.
in my workplace?
Right.
And on top of that, am I going to be able to create and provide the care to those patients that I need to be able to provide and keep them safe at the same time? And that's a whole new level of trust than, say, implementing a new service line or new electronic forms for signing permission slips. There are different levels of trust depending on the risk of the situation. And at the center of it is the agile leader, as I said, who's able to adapt and to account for those various circumstances. My team, what situation is the team in? What task am I asking them to do? And what's the overall environment that they've been introduced to? And they have to be able to live within that as well. Then you have trust among departments. I mean, there's so many variables that are there.
I
The
just love the fact, Bob's, that you start with this, the self-evaluation, because a
Absolutely.
lot of leaders I find don't take the time to think about the values that they represent or the core values of the organization and how that ties into your own individual values. And you have this whole thing written out in the book. If you get that book, it tells you about how to develop this leadership philosophy statement that he's talking about. And when you're so self-aware of who you are and what you stand for, it makes it easier to make decisions, what you've always taught, Bob.
Absolutely. If you have taken the time exactly to do that self-evaluation and you know what you stand for, then you always will fall back to that on that. Leaders are put in a position often because you have to make difficult decisions, things that are not necessarily clear from the get-go. But having those core values that you're basing those decisions upon makes it much easier. And the other thing is that should not be unpredictable to your team.
That's right.
If you've shared those values with your team, then they won't really be questioning how you came up with certain decisions, and what you base those on. The other is, if you're a good leader, you're also including that team in the decisions that you're making.
Yeah, so Bob, talk about I remember a story you told me about when during COVID, and you were going to, they know there's no question what you stand for and who you are. And so there
Right.
was, a lot of times people will come into conflict because there is no transparency. But you kind of you have that out there. Everybody knows what it is. COVID happened. Tell us a little bit about how that really helped you perform as a leader because you had that transparency up front.
Yeah, I think that there's a number of circumstances where that really, really came through. We started and we were, I think, really good. We have a very good emergency preparedness team, but we were very transparent in trying to ensure safety and trying to make sure that our patients were all taken care of. And in the Four Corners area of the United States, we were hit hard by the disease, and so working hard with our teams and talking about what are our values, what are we trying to do? We need to take care of our patients and we need to take care of our team. And so we worked very hard to demonstrate that in every way that we could so that they knew that they were being taken care of and we were looking out for their best interests. It was very interesting, and we were learning as we went about COVID, and we tried to continue to share that so that the information was constantly flowing out. Eh, That transparency and that information flow is incredibly important for building the trust. And if there's a change, and we all know there were lots of changes during COVID, that we're out there on the front lines, we're talking to people, and we're explaining why a change was made. So it's not a rolling of the eyes and say, oh, here we go again, another thing that we're doing. We really tried to be upfront. We followed a very specific protocol about emergency preparedness and incident command, and that really helped us a lot as well.
You're the epitome of a leader who embodies trust. I mean, I remember the story you said when during in the heat of COVID, you were ready to go back into the hospital to help. And they said, no, 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 you stop, Bob,
Right.
stop. No, just go back and do what you need to do to help us.
Yeah, that has to do also with a little bit of my own medical conditions. I have a form of immune suppression, for example. And when I said I want to come and still see patients, and there were other physicians who work with me said, "Oh no, you're not. You have
Oh,
more
wow.
important things to do, and we don't want you to get sick here.
Wow. Yes.
So
They
we'll
need
take
you,
care
Bob.
of the work that you will do,
Wow.
and we need you to be the leader that you are."
Right. Okay. Awesome. Thank you
It
for
was
sharing
it
that.
was phenomenal,
Yeah.
and, yeah, when I think about it and the way especially it's not just what was said to me, but the way my team said it to me,
Mhm.
was really kind of humbling.
That's really that says a lot about you.
Right.
So we started off talking about self-evaluation,
Mhm.
and then you told me a little bit about resources. Can you talk about that?
Yeah, absolutely. So, part of building trust and part of being a good leader, of course, is trusting in your team. So you give them autonomy and you trust it's a two-way street. You trust that they're going to do the job that you ask them to do, and you hold them to a high standard. But as
Mhm.
their boss, you need to make sure that you're empowering them to be successful, and they're counting on you to do that, and that's part of building that trust back. So, are you giving them the resources that they need in order to be successful? Are
Right.
you providing with them with the autonomy? And when one of the big things that I say is my job as a leader is to remove the hurdles and barriers to their success.
Love
So
that.
it's not just the resources in terms of physical resources, but also making the right connections and removing obstructions to policies and procedures. That's one of the things, I said the organization is part of it. The way an organization is set up and operates builds and attracts trust. So are you removing those barriers, even if it may be a policy that actually takes away from trust?
That's
Those are
why
all part of your
physician
job
leaders
as a leader. I'm
right, and
sorry?
that's why it's so important to have physician leadership in an organization, healthcare. There's too much complexities, and it's
Mhm.
very hard for a non-clinician to understand what's going on, and really having that physician leader be able to work from the ground up and understand what is going on in the value zone.
Yeah. Yeah, and, that gets to another discussion that you and I have had is, unfortunately, our medical training does not prepare us to be good leaders. Yet our values are based on the bedside patient care. One of the things that I say in terms of why is it so important that we bring that value, every one of us who is a physician and most nurses that have been at the bedside have been at the bedside, and a decision that we made or failed to make either saved a patient's life or the patient died. And every chief financial officer, every chief operating officer that's out there has made a decision that allowed patients to live or ended up with patients dying because resources may not have been there.
Right.
The difference is that we as clinicians stood at the bedside and watched it happen. And that changes your perspective and it changes your values. And I'm not saying that either of them are more valuable than the other, but if you don't have that clinical leadership at the table too, then you're taking away one of those perspectives, which is vitally important to the running of an organization, that leadership perspective.
Such a great perspective. Thank you for including that.
Yeah.
Then you also spoke about results in terms of building trust.
Yeah, absolutely. If you're in an organization or you're on a team that's just not winning and you're not able to accomplish what you're setting out to do, you're going to start to lose the trust of your team. We have these things that we have goals that we have set, and they're smart goals. They are achievable, they're measurable, they're time sensitive. But if you're never hitting your goals, then you're going to start to lose the interest and the trust. Everybody wants to be on a winning team. So part of gaining trust is that you're achieving the results that you're setting out to achieve. Now, the other is integrity, which comes back to the values component that I was just talking about. And then the last is, do you care about and are you taking care of the members of your team? Are
Yes.
you looking out for their best interests? That is one of the key components of trust. We tend to trust people that we really do think are looking out for us.
Right.
And the other is, if you, and you've heard me say this before, and this is one of the things that is almost so commonly said in the military. I don't know how many times I heard it, but you take care of your people and they will take care of you. And that is one of the key components of being a leader. I take care of my team, and in turn, they're going to take care of me because they know I'm taking care of them.
You see them as a whole person and not just the person who's doing that role and doing that job and getting it done. You see
Uh,
them as the family member, a parent, a community member, not just a nurse, a tech, a doctor, administrator, whatever. So,
Absolutely. And I my book talks about that, and sometimes I have discussions because it's not as common to think that way as you and I might think. Is that, yes, you should know things, personal things about your team members, because those are the things that motivate them. Those are the things that build their value structure. And it's hard to motivate people unless you know really what drives them and what has been the basis of why they're driven in one way or another. What motivates one person may not motivate somebody else, even though we may be working towards the same goal.
that's right. Absolutely. So getting the getting taking the time, even if it's a small, like a minute, to understand and what's going on and to understand that person in front of you. So, thank you, Bob, so much for
Yeah.
that. You always teach me something every time I talk to you. How can people reach out to you if they have any questions and I want to talk to you about organizational leadership?
Yeah, sure. And so my email address is rmunderwoodmd@gmail.com, and I check it every day. Be happy to converse about any of this. It's a passion of mine. Certainly, I've had the pleasure and privilege to serve in two great organizations that are really driven by a cause. First, I was in the military, and then I went into medicine. And now in a leadership role, I'm able to combine both of those passions into a common purpose. And it's just been awesome.
Thank you for your services, and I really respect people who've been in the military. I see
Thanks.
some amazing leaders in healthcare, and it's because of the military and the leadership that they have. So, I if you I just don't want everyone to know that lead physician will start in August, and Dr. Underwood is a part of that, and he teaches the leadership philosophy statement. He didn't do it in the last cohort because of all these COVID issues that resurfaced, but he will be back, and I'm so happy to have him. If you have a topic on leadership for physicians, please reach out to me at info@drlcco.com. Any last words of wisdom for us, Bob, as we close?
No, yeah, I want to say thank you. And, thank you to my team. I wouldn't be here talking to you if I didn't have a great team working with me at the organization where I am. It's allowed me to have the pleasure of, being successful, but also working with a great crew. And not, thank you for this. And, to folks who are tuning in, we need you. We need clinical people to step up into those leadership roles. And it's not like I'm going to turn around, I'm working purely clinically tomorrow and I'm sorry, today, and then tomorrow I'm going to be running a healthcare organization. It's a learned skill. But thank you for listening to the podcast, and we need more clinical people to step into those types of roles.
Absolutely. Thank you so much. That's very inspiring. Thank you, everyone. Stay tuned till next Sunday.